Hello and welcome. In today's video, I will talk about a topic that many men experience but hesitate to discuss: premature ejaculation. We will explore its causes, treatment options, and ways to manage it effectively. What is premature ejaculation? Premature ejaculation is the inability to control ejaculation during sexual intercourse, leading to climaxing within a very short time, usually less than a minute. This can cause dissatisfaction for both the individual and their partner. Causes of premature ejaculation. The causes of this condition are generally categorized into two main groups. 1. Psychological causes: performance anxiety, stress, depression, or relationship issues. 2. Physiological causes: hormonal imbalances, nervous system disorders, genetic predisposition. Treatment options. 1. Behavioral techniques. Start-stop technique: pause stimulation when arousal becomes too intense, then resume to delay ejaculation. Squeeze technique: when you feel close to ejaculating, apply gentle pressure to the base of the penis to delay climax. 2. Pelvic floor exercises, Kegels. Strengthening your pelvic floor muscles can significantly help with premature ejaculation. Identify the muscles. These are the muscles you use to stop urination mid-flow. Tighten these muscles for 3 to 5 seconds, then relax for 5 seconds. Repeat this 10 times and aim for 3 sets daily. With consistency, you may notice improvements within weeks. 3. Topical creams and sprays. These products can reduce sensitivity in the penis, helping to delay ejaculation. Always consult a doctor before using them. 4. Medication. Certain medications, like duloxetine from the SSRI group or specific antidepressants, may help delay ejaculation. However, these should be used under medical supervision. 5. Psychotherapy and counseling. Sexual therapy can reduce performance anxiety and address psychological causes effectively. 6. Lifestyle changes. Reducing stress, exercising regularly, and maintaining a healthy lifestyle can positively impact sexual health. Conclusion. Premature ejaculation is a manageable condition. From behavioral techniques to medications, lifestyle changes to therapy, there are numerous solutions available. Be sure to consult a healthcare professional to determine the best approach for you. If you found this video helpful, don't forget to like it and subscribe to the channel. See you in the next video.